Today I'm going to talk to you about antidiabetic agents, which lower your glucose. So first, what they do. Antidiabetic agents help target blood glucose levels. Insulin is a protein provided to the body from the beta cells that aids in glucose regulation. A normal blood glucose level is between 70 and 100. So anything over 100 would be considered too high, and then anything under 70 would be considered too low. A normal A1C is below 5.7%. A pre-diabetes A1C is between 5.7% and 6.4%. A diabetic A1C is 6.5% and above. Insulin is given when the pancreas is unable to excrete its own insulin, as in type 1, insulin dependent. So in type 1, you need insulin because your pancreas cannot make insulin itself, is pretty much what it's saying. Since insulin is a protein, the route of administration must be sub-Q. It cannot be taken any other way. It can't be taken orally. If it were to be taken orally, it would be destroyed because of the GI secretions and thus be ineffective overall. So the only route would be subcutaneous. Rotation of sites is important to prevent lipodystrophy, which can affect the distribution of insulin. So you need to be sure that you rotate the sites where you give the insulin. You can either give it like in your stomach, or you can give it in your arm. Just make sure it's sub-Q, so make sure it's in the tissue and the fat. Oral meds are given when the pancreas is able to make its own insulin, but needs a trigger to release it. So that's like type 2. So it's non-insulin dependent, but the pancreas is able to make its own insulin, but it needs something to release it. So that's why oral meds are given, but not any other type of med is given. So there is different types of insulin you can give for your type 1 diabetics. And those are injectable sub-Q insulins, and they are, so first you have your short or your rapid acting insulins. Examples of that would be Humalog, Novolog, and Humulin. May be given sub-Q or IV. They have an onset of 30 minutes to an hour. They peak at 2.5 to 5 hours and may be administered multiple times per day, and they're usually given before meals. We also have your section of intermediate acting, which is NPH, which is the cloudy insulin, Humulin N, and that one cannot be given IV. Their onset is 1 to 2 hours. Their peak is 6 to 12 hours, and they may also be administered multiple times per day. Last category we have of insulin is your long-acting. An example of this is Lantus. This cannot be given IV or mixed with other insulins, only sub-Q. The onset is 1 hour, distributed over 24-hour duration, may be administered once daily, normally given at bedtime, so it can last them throughout the bedtime. So then in the morning they'll get like a short-acting insulin. Sometimes there are special circumstances in which insulin can be administered by IV in the hospital setting. There's also insulin pumps that can reduce the number of injections a person can give themselves. So there are different ways to give yourself insulin, but the most common way definitely is sub-Q. We also, like we talked about, we have the type 2 people with diabetes that can take oral medications to regulate their diabetes that do not need insulin, so they're not insulin dependent. Examples of medications for that would be metformin or glipizide. The onset is 15 to 30 minutes, and the peak is 1 to 2 hours, and the duration is 12 to 24 hours. So a little bit different, but pretty much the same. And also with being the nurse, you have to remember that you always check a patient's blood glucose level before administering your insulin, also before giving any oral meds as well. You want to make sure that the blood glucose level is not too high or too low to give the insulin or give the medication, because if it is, then you definitely want to hold it or wait till after they eat before you administer it. You don't need to wait for an order to obtain a blood glucose level, you just do it. And we also need to understand the symptoms of high or low blood glucose and interventions needed. So if you were low, it'd be called hypoglycemia. You might feel weak, fatigue, have a headache, be shaky, anxiety, confusion, tachycardia, and dizziness. You can also have blurred or impaired vision and also be sweating. There's also being too high, so being hyperglycemia. Those would include frequent urination, increased thirst, shortness of breath, breath that smells fruity, or nausea and vomiting. All of those are signs and symptoms of low or high blood glucose levels. So if you were hypoglycemia, you definitely want to get your insulin level, your blood glucose level up before giving any insulin, because otherwise you will just lower them even more. So a thing that my work does is we give them orange juice with sugar, because they need sugar in order to boost their blood glucose level. So anything with high amounts of sugar in it, and then you normally check the blood glucose level within 15 to 20 minutes after giving them something high in sugar. A lot of people use candy, but we use orange juice and sugar. And then if they're hyperglycemic, a way to lower their blood sugar is actually to give them water. They actually do have an increased need for thirst, so water is something that will help lower their blood sugar. And that is the anti-diabetic agents, which are glucose lowering, and that is our group.